Bismillahirrahmanirrahim. Today in this video we are going to learn the veins of the upper limb. What is the purpose of the veins? Purpose of the veins is to carry the deoxygenated blood from different parts of the body back to the heart. So now we are going to learn the veins of the upper limb, which are responsible for carrying the deoxygenated blood from the upper limb, from the arm, from the forearm, from the hand into the heart, so that it may then go to the lungs for further oxygenation. So the veins of the upper limb are divided into two categories: superficial veins and the deep veins. Superficial veins. The superficial veins, their name is indicating that they are the superficial. It means they are located within the skin, within the subcutaneous tissue of the upper limb. In addition, the superficial veins show the extensive anastomosis. Due to this extensive anastomosis, the superficial veins are responsible for most of the blood drainage for the upper limb. The superficial veins and the deep veins. The deep veins are related mostly to the muscles and the bones. Muscles and the bones of the upper limb. So before we come to learn the superficial veins, let's take a tour with the deep veins. The deep veins start at the palmar metacarpals and the palmar digitals. The palmar metacarpals receive drainage from the palm, whereas the palmar digitals receives drainage from the fingers. Then this palmar metacarpals empties within the deep palmar venous arches, whereas this palmar digitals empties within the superficial palmar venous arches. The deep palmar venous arches further empties within the radial vein, whereas the superficial palmar venous arch empties within the ulnar vein. And we are well familiar with the terms radial and the ulnar. We know the term radial is related with the radius bone, which is the lateral bone of the forearm. It means the radial vein. Radial vein receives drainage from the lateral forearm plus the muscles and bones of hand. In addition, the ulnar vein runs medially. It means it drains the medial aspect of forearm, including the muscles and the of hand. The radial vein and the ulnar vein anastomose and give a single vein, which is called the brachial vein. It means the brachial vein receives drainage from the ulnar vein and the radial vein, and this happens at this anastomosis of the ulnar vein and the radial vein happens at the elbow joint, just inferior to the elbow joint and its anterior aspect. This brachial vein receives drainage from the arm and from the elbow. When you always read the term brachial vein, it means it is located within the arm. This brachial vein then further runs. After the arm, the region is the axilla, and within the axilla, after it reaches the axilla, this brachial vein becomes a axillary vein. Axillary vein, it means axillary vein is within the axilla and it receives drainage from the axilla, from the arm. How it's the arm? We know the arm drainage from the arm is being drained into the brachial vein. Then why the axillary vein is also getting drainage from the arm? Because the brachial vein empties within the axillary vein, and hence we can also say that the axillary vein also receives drainage from the arm. Plus it also receives drainage from the superolateral chest wall. This axillary vein further runs and is called as the subclavian vein. After it exits the axilla region and at the level of the first rib, it is called as the subclavian vein. The subclavian vein joins the internal jugular vein. The subclavian vein joins the internal jugular vein, and this internal jugular vein and the subclavian vein, both of these empty within the brachiocephalic vein. Within the brachiocephalic vein. Brachiocephalic vein is the last of the deep veins. This brachiocephalic vein then opens within the superior vena cava, which further drains all the deoxygenated blood within the right atrium of the heart, and hence is further pumped and further processing is there, and it reaches the lungs for further oxygenation. So that was all about the deep veins. Now we come to learn the superficial veins. The superficial veins start at the dorsal venous arches. The dorsal venous arches receives drainage from the dorsal metacarpals, which is emptied by the dorsal digitals. Dorsal digitals receives the deoxygenated blood from the fingers, which empties within the dorsal metacarpals, and the dorsal metacarpals empties within the dorsal venous arches. This dorsal venous arches drains into two veins, that is the cephalic vein and the basilic vein. As the basilic vein and the cephalic vein, both of these are receiving the deoxygenated blood from a common source. It means both of these veins are connected with one another at some point, and the point at which the cephalic vein and the basilic vein join each other is the median cubital vein. This median cubital vein is the point of attachment for the cephalic vein and the basilic vein. The basilic vein receives the deoxygenated blood from the medial arm, whereas the cephalic vein receives the deoxygenated blood from the lateral. Actually, it's the anterolateral arm. This basilic vein joins the brachial vein, and then further the brachial vein empties within the axillary vein, whereas this cephalic vein joins the axillary vein directly. Again, thus the basilic vein. The basilic vein joins the axillary vein via the brachial vein, whereas the cephalic vein joins the axillary vein directly. It empties directly within the axillary vein, whereas the basilic vein empties into the axillary vein via the brachial vein. So that was all about the veins of the upper limb.